Hi guys, welcome to my YouTube channel. My name is Dr. Achievements. Today I'm talking about the topic hypertension. Hypertension has been known to the world as a health issue, a very dangerous medical condition. It's known as a high blood pressure, HBP, in a case whereby the blood in the arteries or the vein is so high, and it's a long-term medical condition in which the blood pressure is in the arteries is persistently elevated. Same thing I just said. Okay, a very long-time medical condition. The SBP will be more than or equal of 140 mmHg, and the DBP will be more than or equal to 90 mmHg. The SBP means systemic blood pressure, systolic blood pressure, sorry, and the DBP means diabolic blood pressure. Okay, so there are types of hypertension. Uh, just 1 minute. Okay, there are types of hypertension. Pre-hypertension is the early stage of hypertension, and we have the hypertension stage 1. We have the hypertension stage 2, and we have the pregnancy-induced hypertension. The pre-hypertension, SBP, 120, the high blood pressure will be 120 to 139. And the DBP, I explained recently, SBP means systolic blood pressure, and DBP means diabolic blood pressure. So 120 to 129 is for the pre-hypertension. DBP 80 to 89. Sorry. And the hypertension stage 1, it's high. The normal value. I said one. SBP, the normal value. When I said it's 140, and the the SBP will be more than or equal to 140, and the DBP will be more than 90 mmHg if someone is suffering from hypertension. But the normal value is 120 for SBP and 180 for DBP. But if pre-hypertension is there, it's going to 80 to 89, more than 80 to 89, and 120 to 139. So hypertension stage 1, we talk about SBP going to 140 and to 159, and DBP going to 90 to 99. DBP going to 90 to 99, no longer 80 again. And the hypertension stage 2, SBP more or equal to 160, and DBP is going to 100. Pregnancy-induced hypertension, because of the increased production of hormones and enzymes during pregnancy. So due to increased hormones and enzymes during pregnancy, the blood pressure will be high. Blood pressure is the the pressure of the blood running through the arteries. Okay. Etiology, sorry. Etiology of hypertension. We talk about the primary and the secondary etiology. Primary hypertension, it is the elevation in BP without an identified cause. Sometimes it does happen that someone will have some issues like elevation of blood pressure without an identified cause. It's so common. And secondary hypertension is it is the elevation of BP with an exact cause. So this secondary hypertension, this type is accounted for 5 to 10% of the total cases. This case of secondary hypertension include cases like congenital narrowing of aorta, renal disease. If you don't know these words, I won't go deep into it. You can just go search for the word to know the meaning. Endocrine disorder like Cushing syndrome, neurological disorder like brain tumor and head injury. Neurological disorder should be very common. Sleep apnea, medications like oral contraceptive pills, NSAID, cocaine, and cirrhosis of liver could trigger this secondary hypertension. Okay, risk factors for hypertension. It's well common that age can affect hypertension, and age in in age, people who are old, like chances of CAD, uh, cardio disease, after 50 years of age is very common. Alcohol, smoking, diabetes mellitus is that DM there. Excessive dietary intake of sodium, gender, family history is a very big risk factors. It could happen to your family before, and you just inherit it due to genetics. And so most doctors, especially with physiotherapy, we ask, have your family had this issue before? Just know how it's coming by. Obesity, it plays a big role. Gender, I skipped gender. Gender, female have more, may have in hypertension have more chances of hypertension compared to female. And excessive dietary intake of sodium, sorry, I, I didn't explain that. It means like more intake of salts could lead to hypertension. So, shocking to see that. Alcohol, smoking, we know diabetes mellitus, common. Obesity, somebody having a big body mass, the blood pressure will be high, and they won't be able to, like, obesity, I mean fat, somebody who is fat. Sorry for using that word, language, fat. Somebody who is very big in BMI, okay, they have more chances. Sedentary lifestyle, someone who is not managing their lifestyle nicely, and stress. Oh goodness, that is a very crucial one. Clinical features. Sometimes the blood pressure does not cause any symptoms, so that it is known as silent killer disease. Hypertension is known as silent killer disease because the blood pressure sometimes does not cause any symptoms. You can be in pre-hypertension for many years, you won't have any symptoms, and suddenly little something will happen to you, and poof, you just skyrocket to a severe or a very intensified hypertension. So, yeah, that is one clinical feature. In some patients, the symptoms we develop like severe headache, blood vision, dizziness, nausea, vomiting, fatigue, confusion, epitaxia, chest pain, shortness of breath, irregular heartbeats, papilledema. Guys, I won't have that time to explain most of this. You can just go search for the meaning. And in case I'm doing any mistake, please do one nice thing for me. Write in the comment box below so that I will know what mistakes I'm doing. And okay, going to the management of hypertension. As a sports physiotherapy, I'm going to my own field, like the way I will manage hypertension. I will not be going to the medical aspect the way they will manage their own hypertension. So, as a sports physiotherapy, what I will recommend or tell my patients is what I will tell you right here. Uh, Management of hypertension. Mainly, the management of hypertension is possible by two ways, which include lifestyle modification, pharmacological therapy, yeah, drugs, pharmacy, yeah, they play a big crucial role when it comes to management of hypertension. Then the SBP, which I've been talking about, systolic blood pressure, DBP, diabolic blood pressure. So if the systolic blood pressure is 140, or resting diastolic blood pressure is 90 mmHg. So ESRX testing, okay, exercise testing, exercise resting testing. Recommendation include the following: individuals with hypertension whose BP is not controlled, resting SBP over 140 mmHg, or DBP 90 mmHg should consult with their physicians. Okay, okay. In this case, the slide was advising you consult your physicians. Please, guys, if you're having hypertension and you're watching this video now, please consult to any nearest doctor. Don't go and start taking the medications you see here without, because all the treatments have something called side effects. So you should know side effects before you take any treatment, and only doctors know more. All right. So individuals stage of 2 hypertension, SBP 160 mmHg or DBP 100 mmHg, or with target organ disease like ventricular hypertrophy, retinopathy, must not engage in any exercise, including exercise testing prior to a medical evaluation. Okay, if you're having, if you're in the second stage, we divided the stage into the types of hypertension into 4 types. We have the pre-hypertension, we have the um, we have the pre-hypertension. Yeah, we have the hypertension stage 1, hypertension stage 2, and stage 3. So if you're going to hypertension stage, sorry, it's not stage 3. I think pregnancy-induced hypertension is the next one. But if you are in 160, then you're in hypertension stage 2. In this case, you don't need exercise. What you need is to consult your doctor, and more evaluation should be carried out, and you should know on how to manage it consciously. So, okay, a medically supervised symptoms limited exercise test is recommended prior to engagement in an exercise program for this individual. All right. So the last treatments we go to, because I'm going according to my sports therapy, we have something called FITS principle in sports therapy. FITS principle recommendation for individual with hypertension. Okay, this is exercise for hypertension. Our pharmacological treatment is there, but we didn't really go into pharmacological treatment because it's not a business of us with physiotherapy or sports therapy. In pharmacological treatments, there are some other medications which can help hypertension patients, which I won't go into. Okay, you can, anybody who is watching this PPT now, I'm giving a assignment. Tell me, what are the medicines which can help hypertension patients and stand the chance to win something from me? I'm so dead serious. If you tell me, you may it. So my email, which I'll be keep putting down below. So the fifth principles recommendation for individual with hypertension, we have frequency, intensity, time, and type. The F means frequency, the I means intensity, time for one T, type for another T. So the fifth principle, uh, we have three types of exercise which are there. We have the aerobic exercise, resistance exercise, flexibility exercise. So in the frequency, 5 to 7 days per week for the aerobic exercise, or resistance exercise 2 to 3 days per week, flexibility exercise 2 to 3 days per week. So intensity of this fit principle is just a principle which we use for exercise. We check for the frequency we want to give the patient. We check for the intensity we want to give to the patient. We check for the time and type, the amount of time and the type of exercise. Okay. So our intensity, moderate intensity, 40% to 59%, VO2 or HRR repetition 12 to 13 on 60 on a 6 to 20 scale. So if you go to the time of this aerobic exercise, 30 minutes of conscious or accumulated exercise if intermittent exercise performed begin with a minimum of 10 minutes about. So in the time we say 30 minutes, we talk moderate intensity, 40% to 59% of the VO2 max of the person or heart rate, the repetition 12 to 13. So if you are going to the type, we talk prolonged rhythmic activities using large muscle group, walking, cycling, and swimming. So like in the aerobic exercise, we are basically doing walking, cycling, or swimming, and we are doing it 30 minutes, or we are doing it for the time, 30 minutes for the time. Aerobic exercise intensity, you don't have to do much. The patient is suffering from hypertension for Christ's sake. So you have to keep the intensity as low as 40% or 50%, 59% of the capacity of the person. Okay, each human being have 100%. Okay, we have 100%, but you don't have to give too much. Take it slow. Okay, so the resistant exercise, the intensity should be 60% to 70%. You are not going 100%. The patient is having hypertension, so that you will not trigger heart issue or etc. There's too many issues with this involving hypertension. So one repetition may progress to 80%, one range of motion. For other individuals, novice exercise beginning with 40 to 50%. Okay, so the time should be 2 to 4 sets of 8 to 12 repetitions for each of the major muscle group. 2 to 4 sets, 8 to 12 sets for repetition of each of the major muscle group. The resistance machine, free weight and or body weight. Okay, resistance machine, free weight, the type of exercise you're giving. Okay, so in the other one, which is resistance exercise, the type should be resistance machine, free weight, or body weight. Okay, so you know the intensity. We are going to the last one, flexibility exercise. The flexibility exercises should occur 2 to 3 days per week. The resistance exercise, same protocol. You can change the protocol if you're very some doctors who knows a lot. It can now change their protocol, but this is the main protocol we follow. Depending on what you want to do. Stretch to the point of feeling light tightness or slight discomfort. Okay, and how many minutes are you going to hold? Okay, the time 10 to 30 seconds of stretching, repetition of the exercise. So the static dynamic PNF stretching should be the one. So guys, this is all for hypertension which I'm covering today. Do let me know. Send me the medication for hypertension. All right, medication of hypertension. Check below, you will find my email. Send it there. Stand a chance to win something. Depending on how you send it. All right, I'll check for the best, and if none pleases me, I'll just ignore, and I'll keep my gifts to myself. Send me. I need like there's lots of medications for hypertension in pharmacology department. So thank you very much. Do have a lovely day. Bye.